Well, this is a very nice way to end a Monday morning. Just as many parents take their children to the dentist for regular checkups, more and more are also taking them to a chiropractor to check out their spinal development. Well, chiropractor Dr. Doug Blackbourn is here to tell us more. And let's talk about little ones first.
Little ones,
because
yeah.
I would have thought that they were born perfect.
And a lot of people do. And it's one of the things for, I guess, over 100 years now, the chiropractor's been checking kids. And one of the things we've noticed is that the birth process itself can cause a bit of trauma.
Right, so it's going through the birth canal. Sometimes the spine gets a little bit...
Can get a little bit stressed, and also when they're in the womb. If the labour is long, extended, and the child's not moving, it can be that compression coming on.
Okay. I mean, Zach here is 10 weeks old.
Yep.
So at this age, would you look at some babies?
I think we checked Zach when he was about a day or 2 days old.
Really? And what did you do?
What we do with Zach is really simple. It's when you're working with kids at this age, you're really just holding pressure for a period of time, okay? And you're checking the movement, because what tends to happen with babies at this age is that the top part of the neck, when the head comes through the birth canal, can get twisted and pulled as the head's delivered.
Parents might notice this. They probably didn't. Zach's parents probably didn't when he was 1 day old. But when they're breastfeeding, you might notice that they're less comfortable turning their head. Is that right?
Yeah. Well, they tend to prefer one breast than the other, and the mums often think it's them. And what happens is often it's the child has a sore neck. And adults know when they have a sore neck, you don't want to turn. Well, the kid's not going to say they've got a sore neck. They just won't turn the head one way.
Right.
You also notice that with children, they won't want to turn one way. They'll always turn one way all the time.
Okay.
And children, when they're young, they should be both sides, left and right. Everything should be sort of random.
Even. Well, you've got a big 7-year-old boy right next to you today, and one of the problems, I guess, for big 7-year-old boys, because this little boy's doing 7 today, is heavy school bags and things like that.
Yeah, and the most important thing these days with kids is their school bags and their sitting. And with the school bags, with young James here, James, you want to stand up for us and turn with your back to that way. The important thing with the school bags is it's got to be kept reasonably high. And even at this age, I know James, the bag he usually takes school, he has a carry bag on the wheels, and they're brilliant.
You see that a lot these days.
Yeah, and you want to have it up, you don't want to have it too low, and you've got to keep it pretty light. A lot of bags, if you weigh the kids, if the bag's getting above, kids at, say, 30 kgs and you've got a bag that weighs 10 kgs, well, you're going to get this whole...
Getting pulled back. Parents will be nervous about having their children's spines played with.
Absolutely. And one of the things you've got to be aware about, it's been done for a long time. It's extremely gentle. It's a pressure. Some chiropractors, we can use this thing we call an activator. And basically what it does, it sends a spring-loaded impulse. And if we use this, and just sends a ball, and just is enough just to
make a minor adjustment.
Minor adjustment. Kids often don't need a lot. And as we say, the sooner you check kids, the better.
Great. Doug, thank you for joining us this morning, and thanks to our 2 little stars as well. I'm quite comfortable right here. Nice to have you with us.
I was prepared, of course, if things had gone wrong, I was prepared to take over in the baby department.
Do you think he looks
but
quite
it wasn't
happy
necessary.
with me?
Yes. I think his head's a bit skewed, though.
Here you go.
No, okay, fine, good.
It looks like falsehood.
Here we go. Oh, there you go, little munchkin.
There you go, there you go.
Zach, we'll check you afterwards.
Oh, that's good. All right, we'll tell you what's going on around the country when we come back.